So, hi ma'am, good day. My name is Eirene GAPATE from NR11 Group 2, and today I am going to demonstrate the procedures in assessing the neck vessels, the thorax, mainly the lungs, and the heart. So, the equipment that I will be using in this procedure is a stethoscope, a marking pen, and a centimeter ruler or tape measure. So, hi sir, good morning. Ako ulit si Eirene, first year nursing student from UDM. So, ano pong pangalan niyo sir?
James Liward.
Okay. Kailan po kayo pinanganak, sir?
December 17, 1999.
So, ilang taon na kayo, sir, ngayon?
21.
Okay. So, sir, ganito. Ngayon, magkakonduct po ako ng physical assessment or examination sa inyong chest. Kung saan later on, pakikinggan ko po yung tunog ng inyong paghinga, pati na rin ng tibok ng puso ninyo. Tapos, meron din po ako mga ilan lang itatanong sa inyo about your past and present health. Okay lang ba? Okay. So, kamusta naman po pakiramdam ninyo, sir? Comfortable naman ba kayo ngayon?
Opo.
Okay, so sige. Sa present nyo, sir, meron ba kayong na-experience ngayon na chronic illness na pwedeng maka-apekto sa lungs nyo, gaya ng heart disease?
Wala.
Renal disease?
Wala.
Very good. Merong allergies ngayon?
Wala.
Okay. May hirap sa paghinga kapag nakahiga?
Hindi.
Di naman. How about hirap sa paghinga kapag ginagawa niyo yung mga daily activities ninyo?
Hindi.
Okay. How about, meron ba kayong oral medications na tinitake for respiratory disorders?
Wala.
Good. May ginagamit na inhaler?
Wala rin.
Or oxygen sa bahay?
Wala.
Sige. May ubo ba kayo ngayon, sir?
Wala.
Okay, good. Sa past nyo, sir, nagkaroon ba kayo ng any problem sa inyong lungs, gaya ng asthma?
Hindi.
Bronchitis?
Hindi.
Emphysema?
Hindi.
Okay. How about pneumonia?
Hindi.
Okay. Cystic fibrosis?
Hindi rin.
TB?
Hindi.
Or lung cancer?
Hindi.
Okay, very good. Nagkaroon ng chest injury?
Hindi.
Chest surgery?
Hindi.
Okay. Sa family niyo, sir, merong history ng cancer?
Wala.
TB?
Wala.
Cystic fibrosis?
Wala din.
Okay. Emphysema?
Wala.
Meron po bang may asthma?
Wala.
Okay, very good. Nag-i-smoke po ba kayo ngayon, sir?
Hindi.
Okay. Sa home environment niyo, sir, meron ba kayong mga alam na factors na maaring makapekto sa condition ng inyong lungs, gaya ng malapit kayo sa factory,
Hindi.
construction sites,
Hindi.
or highways?
Hindi rin.
Very good. May naninigarilyo sa bahay?
Wala.
Very good. Nagwo-work na kayo ulit, sir?
Hindi pa.
Okay. Sige po, proceed na tayo sa physical assessment. Then, pakitanggal na lang, sir, ng shirt ninyo para mas makita natin yung appearance ng chest nyo. Sige, sir, pwede ba kayong tumalikod sandali? Unahin natin yung likod ninyo. Okay. So, the skin color of the patient's chest is quite consistent with his overall complexion, with no pallor or cyanosis present. Aside from that, the patient takes his breath in a relaxed position and he supports his body weight with his arms comfortably in his lap. In addition to that, the patient's breathing is effortless, regular, and there is no noise produced when he is breathing. There is also no retraction or bulging of intercostal spaces on inhalation, and the accessory muscles are not used to augment respiratory effort. So ngayon, sir, magpapalpate po ako, then sabihin niyo sa akin kung merong masakit, okay? May masakit ba dito?
Wala.
Dito.
Wala rin.
Dito.
Wala.
How about dito, sir?
Wala rin.
Okay, good. So, there is no pain, nodules, or lumps upon palpation. Ngayon, sir, i-test naman natin kung nag-e-expand parehas yung inyong thorax. Then, mag-inhale and exhale po kayo ng malalim, okay? Sige, sir. Inhale and exhale. Okay. Okay, very good. So, my thumb expand or moves apart separately or symmetrically. Thus, there is no lag in expansion. Ngayon, sir, sabihin nyo po is 99 kapag sa tuwing nararamdaman ninyo na dumadampi yung aking palad sa likod ninyo, okay? Sige, sige, sir.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, good. So, the vibration feels the same in each corresponding areas of the patient's posterior chest. Ngayon naman, sir, mag-peppercast lang ako saglit, okay? Pwede ba ninyong yakapin yung sarili ninyo? Yan. Okay. Saglit lang, sir, ha? Okay. So, the rest of the lung fields gives me a resonant sound which is normal. Ngayon naman, sir, mag-peppercast ako ulit and itetest natin kung hanggang saan nag-e-expand yung inyong diaphragm, okay? Okay. Sige, sir. Ngayon, hinga po kayo ng malalim. Hinga ng malalim, then paki-hold nyo, sir. Hinga ng malalim na malalim, okay? Hold nyo, sir. Okay, sige, okay na, sir. Hinga na ulit kayo ng normal. Okay. Ngayon naman, sir, hinga ulit ng malalim and then exhale nyo hanggang maubos talaga yung hangin, okay? Then hold nyo doon. Okay. Sige. So, dito naman ako sa kabila, sir, ha? Ganun din. Hinga po kayo ng malalim. Then hold. Okay na, sir. Hinga na ulit ng normal. Hinga ulit kayo ng normal, sir. Okay. Then, inhale ng malalim, then exhale hanggang maubos yung hangin, tapos hold nyo doon, sir. Okay na? Sukatin lang natin, ha? Okay. So, the diaphragmatic excursion is equal bilaterally and it measures about 4 centimeters, which is normal according to his age. So, ngayon, sir, mag-auscultate naman po ako para sa paghinga ninyo. Papakinggan ko yung breathing sounds nyo, okay? So, gusto ko, sir, mag-inhale and exhale po kayo ng malalim every time na nararamdaman ninyo na dumadampi ito sa likod nyo, okay? Okay. Sige, sir. Okay. So, the breathing sounds are clear over the posterior and lateral thoraxes. There is no adventitious sound heard. Ngayon naman, sir, mag-auscultate ulit ako para po sa voice sounds. Dito malalaman natin kung merong consolidation or masses sa inyong lungs, okay? Okay. Kapag naramdaman nyo, sir, na dumampi ito sa likod ninyo, gusto ko sabihin nyo 99. 99 or 1, 2, 3. Anong prefer nyo, sir?
99.
Okay. Sige.
99. 99. 99. 99. 99. 99. 99.
Ngayon naman, sir, sabihin nyo E sa tuwing maramdaman nyo to, okay? Mahaba, sir. Okay. So, the presence of bronchophony or whispered pictorial loci is not observed or not heard as evidenced by a muffled 99. Also, the presence of egophony is also not heard as evidenced by the muffled letter E. Thus, there is no lung consolidation present on the lungs and the lung tissue is present. So, sir, harap na kayo, sir. Okay. I-palpate lang natin to, sir. Kung masakit ba dito?
Wala.
Dito?
Wala din.
Okay, walang masakit.
Wala.
How about dito?
Wala din.
Saan? Wala?
Wala.
Dito, sir.
Wala din.
Dito.
Wala.
So again, there is no lump, nodules, or pain upon palpation. Ngayon, sir, ganun din, gagawin ko lang ulit yung ginawa ko sa likod ninyo, okay? Hinga po kayo ng malalim, ha? Para po makita natin kung nag-e-expand ba ng maayos yung inyong thorax. Sige, sir, hinga malalim. Sige. Isa pa. Okay. So, my thumb again moves apart symmetrically, thus there is no lag in expansion. Ngayon, sir, sabihin nyo ulit 99 kapag naramdaman nyo to. Okay?
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Dito, sir.
99. 99.
Dito, sir.
99. 99.
Okay. So, again, vibration feels the same in each corresponding area of the patient's anterior chest. Ngayon naman, sir, magpe-percuss lang ako ulit, ha? Taas nyo ng onti, sir. Okay. So, during the percussion, I think there is a little bit dullness on the patient's left anterior chest due to the presence of heart, and on the patient's right lower chest due to the presence of a liver. But the rest of the lung fields gives me a resonant sound, which is also normal. So, sir, mag-auscultate ulit ako para sa paghinga ninyo, okay? Hingang malalim, sir, ulit kapag naramdaman nyo yung stethoscope ko. Hingang malalim, sir, ha? Sige po, isa pa. So during the auscultation of the patient's anterior chest, I heard all three different breathing sounds. So first, the bronchial breathing is heard on the patient's neck over the trachea. The bronchovesicular breathing sound is heard at the central area of the patient's anterior chest around the sternal border. And of course, the vesicular breathing sound is heard on or throughout the lung fields of the patient. So sir, ngayon, test ulit natin yung voice sound kung saan para malaman natin kung merong consolidation na nangyayari sa lungs nyo. Okay? So sabihin nyo sir ulit, 99 kapag naramdaman nyo to. Or 1, 2, 3 na lang para iba naman.
Okay.
Okay.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Sige po.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, very good. Ngayon naman sir, sabihin nyo letter E. Okay, kapag naramdaman nyo to.
E. 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 E.
Ito sir.
E. E.
Okay. So again, the presence of bronchophony, whispered pectoriloquy, and egophony is not observed or heard as evidenced by a muffled 1, 2, 3 and muffled letter E. Thus, there is no lung consolidation and the lung tissue or normal lung tissue is present. So ngayon sir, magpo-proceed naman tayo sa assessment sa inyong heart. Okay? So ngayon sir, lingon nga kayo doon. Saglit, itignan lang natin yung Sige sir. Okay, how about sa kabila? Okay. So, pulsations on the vein is visible, but I think it is not the vein itself. And there is no jugular vein distension. Sir, magpapalpit lang ako ha. Iaano lang natin yung sa tibok ng puso ninyo. Okay? Okay. So the apical impulse is palpated in the mitral area. I think it is in the fifth midclavicular line, and its amplitude is quite small, like a gentle tap. Then there is no other vibrations or pulsations present on the left sternal border. So, ngayon sir, mag-auscultate ako ha. Auscultate po natin yung 5 points ng inyong cardial. Okay? So I heard the heart sounds in all sides, and I think the sound 1 is louder than the S2 on the apex, on the tricuspid valve at the 4th left intercostal space, and in the mitral valve at the 5th mid-clavicular line. So sir, ngayon papalpate ko lang po yung carotid pulse mo, okay? So, the pulses on the carotid artery is easily palpable, it is regular, and is 2+ bilaterally. Ngayon, sir, i-auscultate ko yung ugat ninyo dito para makita natin kung may present ng bruit or brute. Ito yung abnormal sounds na napoproduce ng ugat natin kapag nagkakaroon ng blockage. Okay? Tapos, i-hold nyo po yung breath nyo sandali lang. Okay? Hold lang ng breath. Okay, sir. So, as expected, I did not hear sounds or any sounds in his carotid artery bilaterally. Ngayon naman, sir, i-compare lang natin yung inyong carotid pulse sa inyong apical pulse, okay? Pwede naman po kayong huminga ng normal. Ito po tayo mag-auscultate ako dito. So, yan. Sige, sir. Ipid na. Okay. So as I auscultate and palpate at the same time, it appears that the sound 1, which is louder at the apex of the heart, is synchronous with the carotid pulse. So sir, okay na po. Nakuha naman natin lahat ng subjective and objective data na kailangan natin. Pwede na po ulit kayong magdamit. And pantay na lang po si Doc dito, okay? So that is all for the assessment of the neck vessels, thorax, and lungs and heart. Okay na, pre?